Hi everyone, how you doing? Today let's look at what options you've got if you've been told that you have no bone for all on four. So a lot of people who've been told this have either had loads of gum disease or they've got a removable denture which they've worn for years and years and years. Now you're looking to upgrade and this denture has literally just eaten away all of the bone. So there are options and let's look at them now. So firstly, I'm going to say this is more of a problem in the top jaw than it is in the lower jaw. In the lower jaw, there's usually enough bone kind of in the front region to get 3 or 4 implants in. Okay, and if you have 3 implants there, you can still get a good number of teeth on 3 implants. In the top jaw, we have other stuff going on. So as soon as you take your teeth out, there's air sinuses, which are kind of in our cheekbone kind of, and they will expand, they will reduce the amount of bone available. So you can see this stuff on X-rays. So a lot of people will send X-rays like this saying, hey, look, can I have all on 4 or something? And we can get a general idea of the amount of bone. So this is an X-ray from somebody who can have all on 4 without even thinking about it. It's a relatively straightforward case. And here's an X-ray of somebody who has got hardly any bone available. So you can see there's a big difference if we compare left and right. And there's no way of telling what your situation is if you're thinking about this without taking a scan. Okay, so we need, it doesn't need to be a CT scan, but CT scans are better. Now, there's a couple of ways of fixing this or still having implants. We could go the traditional method, which works amazingly, and that is to have sinus lifts done on both sides. Now, a sinus lift is basically a bone graft within the sinus, and a lot of people are put off just because we're messing around with the sinus. But on the X-ray, this is the air sinus. It's actually got a kind of a skin around it on the inside, and we just gently lift that skin up and put our bone graft material in there. We then suture, we close up, and over time your own bone will form there, and that's what we're going to use to place our normal implants. The good thing about this is that it's a relatively straightforward treatment. Okay, sinus lifts are not easy, they're not like the first thing a dental surgeon is going to learn, but experienced dentists who place loads of implants will be able to do this. But the downside is, especially if you've got no teeth at all, that we need to let the sinus graft heal typically before we can put implants in, and that could extend our overall treatment to about an additional 6 months. Okay, so it takes a long time for that sinus graft to really heal. Now, let's say you're in a situation where you've got no bone and you really don't want to have sinus lifts. What else can we do? So there are other implants. So like this, okay, we can put what we call zygomatic implants in. This is like just a model. It's not obviously not a real human, but you can see here, this is where the teeth would be, that's where the gum would be, and we've got these 2 implants. They're really long, but they engage in the cheekbone, and this is the bone that you can feel right here. Okay, that's where the implants will go. That's a really good quality bone there, but this is a really, really advanced technique, and it doesn't come without its own risks. So I've seen terrible X-rays, okay, of people who have used zygomatic implants in just the wrong fashion. And I suppose one of the biggest risks, especially for an inexperienced or not very well-trained dentist, is that this is what we call the floor of the orbit. This is right next to the eye, okay? And we are drilling not far away. So the dentist has to really understand the anatomy of this area to a really high detail. And it's not a case of, oh yeah, just looking at the model and naming all the bones. When you're actually doing the surgery, all you can actually see is that, okay? You can hardly see anything. So the dentist needs to be able to really understand, orient themselves mentally. And I've been doing all on four for years and years and years, and it's only recently I've taken the step up to do to learn more about the zygomatic implants. I've placed hundreds of models like this, but that's not real life. I went to Brazil recently and we placed zygomatic implants day in, day out for real patients under the supervision of more experienced clinicians in the field. And that's where the learning curve, went exponentially high. To give you an idea, to actually just go on that course, not including flights and everything, was about £15,000. So it's a really significant investment, and a lot of clinicians won't do it. One, because they're not going to see enough patients who need zygomatic implants to make it worth their while. But secondly, it's a load of money. Zygomatic implants are possible, okay? And the nice thing about them is that you don't need to worry about much bone grafting. You can usually place the implants and have a temporary set of teeth done in one day. Just like the all-on-4 technique. You don't have to have, say, 2 zygomatic implants here and 2 on there. That's what we call a quad zygo. You can potentially just have 1 on each side if you've got a little bit of bone at the front. So essentially what we do is we mix and match the most appropriate implants in the most appropriate area. But the reason I'm mentioning this implant is, one, because not everybody does it. In fact, there's not loads of people in the UK who do this kind of implant, but it's a really good option. If you've ever been told that you absolutely cannot have all-on-4, the clinician may not be aware of something like this. Now, in addition to this, there are other implants as well, which go in funny angles, utilize bone in different ways. But I'd say this is probably the most kind of almost robust, or the one that we can use in most situations. There's also implants which can go really far back. They're called pterygoid implants. They actually work well with zygomatic implants. And then there's something called like a nasalis, or a trans sinus implant. They kind of got a little bit of a limited use, but it's a possibility. And if you see an experienced surgeon, they'll be able to walk through all the different options, the pros and cons of each one. In terms of the actual treatment, even though it's a much more complicated process and the clinician needs to really understand what's going on here, the actual recovery with something like this compared to a normal all-on-4 is very, very similar. And most people have a little bit of discomfort for 1 or 2 days, but it's probably not as much as they might think, especially if they've watched videos of the procedure, which I don't recommend anybody does. So hopefully this video has been useful, and if you are considering this kind of treatment and you've been told that you just don't have enough bone, there are options. Maybe explore different avenues. If you've already got CT scans and X-rays, you can send them to clinics, and quite often the clinician will be able to have a quick look or a glance over it and give you an idea on what's involved. So until next time, guys, I hope you have a great day, and I'll see you soon.